Hi, everyone. Welcome to the Challenges and Spiritual Gifts of Aging. This is the third session in this webinar series, and I'm joined here with Dr. Pat Hart. I'm so happy to be with you, and I'm so glad everybody is tuning in today. We're at the third session that's called Enhancing Spiritual Care at the End of Life. So thank you all for being with us. This is take 2 for the recording. You won't get a lot of participant questions, but I'm going to try to bring some of those questions in that were asked last time we met and enjoy. So Pat, I'm just going to turn it over to you. And I know you're in North Carolina doing work there. Can you just say a little bit more about your work? And yeah.
Okay, great. So welcome. I'm so glad to do this even a second time. It's kind of exciting. I'm much more relaxed right now. So I'm in North Carolina, south of Asheville, and I went from doing hospital palliative care I did that for about 3 years in the hospital and then transitioned to inpatient hospice. It's 5 minutes from my house. And that was after doing 30 plus years of practicing medicine, both in Minnesota and North Carolina, and doing like kidney medicine, intensive care medicine. So I spent a lot of my career dealing with death, and biographically that makes sense to me because I first experienced loss and death when I was just 17 years old, and my 21-year-old sister died in a car accident. And then 5 years later, my 54-year-old father died in a house fire. So I became intimately involved with the horror of sudden loss, and there's just no time to prepare for that. So I was catapulted into what is this all about? And the difficult thing, or maybe the good thing, was that I wasn't spiritual at the time. So the way I made sense of it was that connection and community is really important in that time. And I know that that was brought forth at the last Sacred Gateways conference when Linda Berg talked about the experience in the community when she lost her daughter. So I've spent most of my career paying attention to how to help people die, and hopefully with some time to maybe prepare and have some closure with loved ones. So my focus today is going to be on just the very end of life, when individual paths of declining health converge as there's a common dying process that occurs when our spiritual members are excarnating. And they tend to produce a constellation of symptoms that varies a little bit by person, but it can be a generalized weakness and loss of appetite, no longer eating, no longer swallowing. There can be nausea, anxiety, actual fears, shortness of breath, and in many circumstances, actual pain, and then eventually just lethargy. I'm not going to talk specifically about life between death and rebirth, but I will point to the fact that it is critical for me to have understood that there's so much more. I mean, when I didn't have any of that when I lost my loved ones, it was very difficult. So I found anthroposophy, and it has been such an inspiration to know that there's so much more. And so to start this off, first of all, I just want to talk about a distinction definition-wise between hospice and palliative care, because they're interchanged a lot, and it depends on the context in which they're used. So I will say that both the palliative care and hospice patients both have a lot of burdensome symptoms, and they need and deserve palliation, which is the act of alleviating suffering. But from just a structure in healthcare and financial structure, a palliative care patient has a 2-year prognosis before they die. It's like your chronic lung, chronic heart disease, some of your cancer patients. And they are still seeking aggressive care. So they're going back to the hospitals and doing a lot of things, but they have a lot of symptoms. Whereas hospice is at the end stage of an illness where there aren't necessarily curative treatments, or the body doesn't tolerate what's being offered. And the people have a 6-month or less prognosis, and they're choosing to optimize their quality of life, and they don't want to go in and out of the hospital. So they will sign up with a hospice team who will care for them in a home, a nursing home, or or when there are extraordinary circumstances, they will come actually into a hospital when it needs more aggressive hospital level of care. So it's a great benefit. And anthroposophic medicine has so much to offer the palliative care population, but the sophistication of what they offer for all these different illnesses is beyond the scope of what we're going to talk about today. But I just want to point out that in particular, anthroposophic care for patients with cancer is remarkable. The use of mistletoe and all the various remedies that can be added, and the allied sort of artistic therapies that help, those all alleviate a lot of suffering, and it points to the approach being more salutogenic. It supports the patient's own healing forces, which is very different than the allopathic model of simply suppressing symptoms or squashing down disease. So I want to honor that palliative care is a wonderful place to provide more spiritual support too, but because this is a short period of time, we're just going to focus on the very, very end part. And so in that light, I like to say that I believe that the most important thing that enhances spiritual care is when the person, loved ones, and staff really holds that death is not the enemy, that death, when somebody's dying, it's a very peaceful, sacred transition. And from anthroposophy, we know it's actually considered a spiritual birth. So that is what sustains me in doing this work. And it doesn't mean that I proselytize or impose it on other people, but just the fact that I am not in the same tumultuous space that the patient and family is, that I can provide much better support. And then that I think that's true for most people who are in hospice care. So the quote that I'm going to begin this with is that in the Life Beyond Death book that I list in the end of the resources, he talks about that the moment of death stands out before our soul throughout our life between death and a new birth. So that sounds like that might be a really bad thing. But when you're looking at the moment of death from the other side, death appears to us as a victory of spirit continuously. And the spirit is extricating itself from a physical, which is quite a feat because there's been a life that's been lived with great purpose. And it appears then as the greatest and most beautiful and significant event. So I think this whole new field of end-of-life doula is really an apt description of what oftentimes is the most helpful at this point, is we are helping to give birth, a spiritual birth. And so we want to look at what are the things that we can do. So in preparing for this next household, preparing for the threshold at the very end of life, obviously anthroposophy gives us really excellent tools. I mean, we learn and practice that how we conduct our life is really important in the bigger picture. And we have practices that allow us to reflect on our life, even with our daily backward review and such, that like I told you, Laura, yesterday, I don't really do because I'm not very disciplined in that respect. But we also do our spiritual studies, so we begin to understand how sophisticated and important it is that we live our lives, and our lives have value and we have a purpose in the whole cosmos. So anything we do that helps people understand that when the opportunities arise without proselytizing, that's really important. So there are things that we can do to support people, and during their earlier periods of alertness, there's some natural things that arise, like memories and thoughts about our life, and they benefit by having somebody witness those sharings, and then offering a wise perspective on what that's all about in terms of the biography. If they haven't done their biography work, even in the last moments, you can capture some really important things. And so people like a wise family, loving family, chaplains, spiritual guides, even hospital physicians can perform and help that. So in particular, if you look at how some of the stages that come up at that period kind of soon before the active dying process happens, you can see that there's a mirroring of those stages immediately after death and what comes afterwards. And so anything we do beforehand helps prepare the way. So for example, the memory pictures, when the life body forces are waning, there are more of those memories that rise up in the soul. And so if you can be with that and understand and maybe think about what that was all about, it's helpful, because you have this life tableau right after you die that's like 3.5 hours, where all of a sudden your entire life is like a picture in front of you simultaneously, and you're with that in a completely different way. And then after the 3.5 days, it kind of expands out and goes away from you, and you have this sense of, oh, this is what I'm giving back to the universe, and it has value. You understand the purpose of your life, and you know that the spiritual beings are going to do something with that experience. Likewise, when you remember things and you start making moral judgments about it, it's not to say bad, 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 or good, good, good. It's kind of, what was that about? And really feeling remorse if you've hurt somebody. There's also the opportunity perhaps for some reconciliation with that person, because certainly after you die, what comes after the life tableau is that intense period where you get the spiritual counter images of your entire life, and it feels like you are experiencing your life through how people felt by your actions, how you impacted them. And particularly when it's been hurtful or not so kind, we really feel that. And it's meant to give us a sense of how to improve, you know, as we evolve spiritually. And then with people who have particularly had difficult lives, if they have developed any ego forces, they can have understandings of the seeds and capacities they develop through that challenge. It's a rare person that just is born with all these wonderful, I mean, usually we have to go through life and have challenges. So it's real if, rather than saying, oh, poor you, you can help them see, geez, how amazing, look what came out of that. And that's really helpful. People want to know that their life had meaning, and those are the big, big meanings of life. And with those ego forces, you develop this inner light that when you get to the other side, there's a subsequent period where this inner light you've developed allows you to really move more fully into the spiritual world. Otherwise, you're kind of limited. So it's really this before you die is an important thing. So let's go into some practical things. So as death approaches, how is the spiritual reflected in what you're seeing your loved one or yourself go through? But usually this is about watching somebody else, because as they become less alert, you know, the loved ones are by the bedside. So I want to look at it from kind of the threefold and fourfold perspective, because I want to give you the sense of how it moves when you're in the excarnation phase. I know that Dr. Gershon had talked about inflammation and sclerosis in his first talk. And we know that when you're a kid, you come in, you've got those high fevers, you're claiming your body, and you're very active in your metabolic pole. And then as you age, you tend more towards the sclerosis, and eventually leads to death. So there's this process we're going through. And the thing I want to point out is that you're fourfold: the physical body, the etheric body, the astral body, and the ego. You know, people have a set idea, oh, the astral body and ego, they're in their head, they give you your spiritual thoughts and all that kind of stuff, but they're really still active in your metabolic pole too. And so when we use medicines that pull the astral and ego away from a deteriorating body, we're pulling it away from doing useful tasks, and we'll allude to that when we talk about opioids. So I'm just going to give you a sense of what the classic symptoms are that occur when somebody dies, so that first of all, you know why they happen, and number two, you know it's normal. And when is it normal not suffering, and when is it normal and maybe they're suffering? And it's kind of tricky to figure out. So if we look at the metabolic pole, the predominant symptom is really fevers, inflammation, and usually people have like a urinary tract infection or a pneumonia, or just a nonspecific fever related to a tumor growing inside them. And it's a natural thing to happen. And it's the body's way to say, this is not me any longer. And it's a way to kind of burn your way out. So just like with a kid who's trying to incarnate, you try not to interfere with fevers because it's a healthy process. In the dying phase, it is also equally important. So in general, I try to discourage people from treating the fevers and to be comfortable. If they're really uncomfortable, you can do a lemon calf wrap, but it's really rare for somebody to be horribly uncomfortable. A lot of it is projected on to them from their loved ones. And so if you explain what its purpose is, they'll usually appreciate it. But in the hospice realm, I mean, it's pretty common for nurses and doctors to say, oh, a fever, let's give Tylenol. It's on all protocols. So you come back from the night and they've been given Tylenol. So you don't always have control over it, but it's an education thing for the staff and the patients, really. And I said yesterday, we've got 2 lovely physicians, well-meaning, and one automatically gives Tylenol because she perceives suffering, and the other one has a more spiritual path in a honoring, and she does it the other way. So it's good for families to be aware of what the issue is so they can advocate. It's all about advocating for your loved one. So the next is in the rhythmic system. Things kind of get a little chaotic as the body's they're excarnating from that part of the body. So you can get a very rapid heartbeat. You can get rapid breathing. You can get irregular too. There's a thing called Cheyne-Stokes breathing, which is not a sophisticated pattern of breathing. I think of it as a less mature, more an immature pattern, and it's speeding up and then slowing down and then pauses. Now, medicines can do that too, so it's a little tricky, but eventually it's fairly consistent. So at that point, the circulation is also labile and getting irregular, and the astral body that's working in the circulation kind of clamps down on the vessels in the extremities. It's like a shock kind of experience where survival says, keep the blood to the brain, so you kind of shut down the periphery. So it's a stressed response. And so this is another thing that whenever we go in and check on somebody, we automatically are going down and we're feeling the feet, we're looking at the knees where this modeling pattern occurs, and we're looking for it as a sign of a progression of the dying process. We don't necessarily have to do anything for it, except Anthroposophy has something to offer, which I'll talk about later in terms of the metal ointments. And then finally, you have the nerve sense pull, and that's where people gradually drift off to sleep. And when people say, oh, we want to die consciously, it's not really that you're awake and then you're dead. I mean, that doesn't make any sense, because, the definition of death is that your astral body, your etheric astral body and physical leave the physical body. By definition, you're not thinking, you're not talking, you've died. But consciousness is really loose at end of life. So people will frequently ask, well, can they hear me? Can they hear me? And I will answer saying, well, hearing is the last sense to go. So always assume that they can hear you. Use that as an opportunity. But truthfully, you can just think it in your mind and your heart and they're still receiving it. But yes, for whoever needs it. But I said, but then they're in a near-death experience, which is a wonderful thing to talk to people about as a kind of a provocative opening on these conversations. In the near-death experience, by all intents purposes, they are out, they don't have brain waves, but they know exactly what's going on. So there's a consciousness, and actually at the time of death, Steiner will say, sleep, when you just have your lower members, the physical body and etheric, that's separated from most of the ego and astral body, you are in a kind of a vegetative plant state. You're unconscious. But so it's the little brother of death. But in death, when you pass over, there is an intensification of consciousness. That's why this whole tableau thing and then the counter images, it's intense. So I think consciousness is a relative term. So when people say, you just can't die awake. That doesn't make any sense, but your consciousness can be awake. So I think anything we can do to promote that is helpful. So I just wanted to clarify that term. So this brings that question up, and do opioids and sedatives interfere with the dying process? Yes. You know, it does impact on your alertness, and you can become absolutely sleepier. But I will say that I was impressed when I went to Berlin and visited the Havelhöhe hospice, specifically as part of their medical complex, that they still absolutely used opioids like morphine and Dilaudid, and sedatives like diazepam. Or lorazepam. I mean, they used it. And when you looked at, so that you can't, disease is so destructive in the physical body in so many ways, whether it's, you know, bones being eaten, you know, by cancer, or lungs that are so fibrotic that you feel like you're suffocating. I mean, they're just symptoms that are horrible, because modern medicine partially keeps you alive so long that it's really bad. So it begs the question, how are we really helping people? You know, everybody says, I don't want to live to 100 because I don't want to be so miserable, you know, so we haven't figured out that part. So with the opioids and so they do use it. And in the hospital, a third of it is opioids and things like sedatives. A third of it is remedies, and a third of it is nursing applications. And we'll talk about this later, but there's usually gold. Homeopathic gold is used whenever they're on an opioid to help mitigate it. So I don't think it's realistic to say, oh, we'll never have to use any of these bad drugs. You know, until you get there, you don't know what you need. You know, so be careful. So let's talk about what opioids actually do and how they do it, because I think it's an interesting description. So opioids are used for pain and for shortness of breath. And pain typically is when your astral body is too tightly like in the physical body, partially because maybe the physical body is like destroyed, so there's no life force there and it's just right in there, or just, you know, the life forces are waning, so there's more of an overall kind of pain, of any little ache or pain. So the way opioids work, and a little bit like how sedatives work too, is they just pull the astral body, the consciousness astral body gets pulled out with the ego with it, away from the physical body, which is better than experiencing the pain for the most part when it's horrific. But an interesting description in the anthroposophic understanding is it's not like the pain goes away completely. It's like you take the pain and you put it all the way over there. So it's kind of still there. It's a little discombobulating because you don't know kind of what that is all about, but you're just relieved that it's not as intense. And I used the example yesterday that, I don't know about you, but when I've got a headache, it's right here next to my thinking. And so it's so much worse than something that's in my calf. I mean, it's horrific. So I think it's good that it's farther away, but it is pulling out consciousness and spirit away from useful tasks that it should be doing. So the good things it does reduce pain. If you use enough of it, it'll reduce pain. And in the anthroposophic hospitals, they say that they still use these things, but they've never had to use the terminal sedation approach when somebody has such severe pain that it can't be controlled any other way rather than just putting them to sleep, essentially. So there's something that they do that's beneficial. It also relieves these feelings of suffocation, because that is what I call an existential yikes. I can't breathe. Pain you kind of can work with. You can say it's not going to last forever, or I can deal with this moment. When you can't breathe, that's an existential anxiety. So what happens though when you take it out from the whole body is you get sedated. You even can have hallucinations, which is really common. You see elderly people who go for hip repairs and they come out and everybody says, oh, you know, grandma's, you know, crazy. What are they doing in the hospital? And then they come out of it because it's a temporary thing. So it does do those things. And it also then, all in the metabolic system, it causes nausea and constipation because it's pulling them out of their normal digestive tasks. So this comes into the active conversation of, so how do you go about assessing suffering, and who is it decides that somebody's suffering, and where's that fine line between suffering but not wanting to be sleepy, because oftentimes people want both, and sometimes that's not realistic. And so in our hospice, this is an ongoing active collaboration between the patient ahead of time, usually, and as long as they can speak, their healthcare power of attorney, and the staff who are assessing it. But there are, like, several shifts of staff, daytime, nighttime. And I will tell you that one of the problems is that all parties overestimate and underestimate. So you can't predict ahead of time who's got the corner on truth. So we do the best we can. And if you're looking at suffering, we'll typically try what we call objective measurements with scales from 1 to 10, but it's still subjective. And so you have, we talked about a drug addict who just really just wants to be put out, and they will say they have horrific pain just so they can get more opioids. And they look perfectly comfortable. So it's really hard to care for them, particularly if they've got a horrible disease that really should cause pain. So it's a line that we have to frequently navigate. And then there are people who say, no, I don't have any pain. And you just look at them cross-eyed and they scream out. I mean, they just do, you just move their arm just a little bit. It's like, ah, and you kind of go, I think you're in pain. You could be more comfortable. And so we're always navigating. And oftentimes it takes education both ways. And it takes little tiny trials. Let's try, an eighth of a dose of morphine and see if you notice any difference. See, you're still awake, and so we do all that, but it really makes it hard to make generalizations about all opioids are bad and all hospices just euthanize people, because it's just not true. And we have lots of families who say, can't we be over with this? And we have to kind of go, that's not our scope of therapy. We're not Oregon. I mean, that's a whole different discussion. But we have to go by our scope. We are allowed to alleviate suffering, and we'll educate you. Your loved one doesn't look like they're suffering at all. You are suffering, and we'll try to help you understand what you're seeing. So it's really that complicated. So it's easier to try to support it from this direction and just say, so how can we maybe just help it be more spiritually harmonious and maybe contribute to a more conscious, however you define that broadly, crossing of the threshold. And so from an anthroposophic perspective, I'm just going to go for the principle of warmth. Warmth in everything anthroposophic is the warmth organism is how the ego moves throughout the body. It is the vehicle, and in the dying process, the warmth organism is really out of balance. Sometimes it's way too high in one place with the fevers from an infection. Other times they're this little lady who's all of maybe 70 pounds, and she's freezing. Her legs are just freezing, and it just looks, I always think about how I can't go to sleep if I've got cold feet, and you just kind of go, that looks uncomfortable. So we're going to talk about plant approaches to warmth and metal approaches to warmth. So we'll look at 3 substances which I think are really useful in end-of-life care. And they're used in nursing applications, and that's a whole nother implication, because the human touch itself provides warmth. So if you prescribe something like in these European hospices, to have these lovely nurses apply substances that create warmth, and they bring the warmth of heart, it's just a win-win, and it's beautiful. This is why I'm dedicated to helping nursing applications become more used in the hospice setting. So if we look at Solum, peat extract, it has a function by doing like a protective sheath. So even if you don't create much warmth, at least you'll keep in what you make. And so this is something that's very useful in people who are very sensitive to their environment, people who give themselves away and kind of pour out, people who have weather sensitivities. It's also been shown in research to be helpful in chronic pain. There's something about having a protective sheath that just helps you deal with chronic spine and joint pains, and particularly nerve pain, which is a really difficult thing to treat. So that's one thing. And then the lavender, everybody knows how wonderful lavender is. It has that just, kind of very relaxing. There's aromatherapy that says it absolutely helps anxiety. It's deeply warming, but it's kind of a cool warmth in a way. It kind of expands things. So that's used in nursing applications. We'll talk about where. And then rose is just, it's this restorative caring. It's very harmonized, and you can just feel it works at a soul level. You look at a rose and it's so beautiful and harmonious in its shape and its fragrance. And so as an oil, it's just relaxing, and it also has a very soft encompassing warmth. So it's a lovely substance to use. And so from our anthroposophic companies, these are the typical things that are available, and they're all wonderful, so it's really helpful if you can, use them. So then the metals are a whole nother kind of a higher octave in some ways, because metals are specific to calling in the ego forces specifically into certain organs, which have both functional aspects, but also kind of a bigger sort of fourfold sort of function. So aurum is the metal for the heart, and everybody kind of gets it. That's kind of the center of who we are. And so it's a very spiritual thing. So the ego going to the heart is a big deal. And then the copper is a very nourishing warmth, and it is the metal for the kidney. And the kidney is the main organ for the astral body. So you've got one metal for the ego that's in the heart, that's kind of the ego, and one for the astral body. These are our two higher members that are really going through a lot in the dying process. So we want to support the soul spirit as it goes through dying. So just more detail. The gold provides a spiritual warmth, metal of the heart. It has sun forces, and it's a very noble metal because it doesn't combine with a lot of things. So it kind of just holds a center and isn't distracted by being with other things. It restores equilibrium, and it also fills the human with light. And people go through difficult times, and it's nice to be using gold before the actual dying process if you can, because it does lend light to what's coming, because there's a lot of fear and anxiety with it. So it's just got a lovely, this is the message of the whole thing. Aurum, aurum, aurum is what I would say is really important. And in Europe, I was impressed that they use it whenever the opioids are being used, because they know these opioids, cause more sedation, cause more nausea and constipation. So it's a way to just mitigate some of that. I'm not sure if it entirely takes it away. It's really hard in an individual person, because there are people that are very awake throughout, even on high doses of opioids, and there are other people you give them one tiny dose and they're out of it. So you never know what's medication, what's the dying process. And when I'm using the gold to help, there's so many variables going on, just the individual and what the staff is doing, because they have to do by their scope what they need to do, working with the family. So it's next to impossible, but there are circumstances where I've seen some dramatic changes that could only be explained by the gold. And so that just makes me do it because it's the right thing to do. You're supporting the spirit and ego from within. And I just think it's one of those things that nobody else offers in Western medicine. It's very unique. You can have all the people praying out there and doing that lovely thing that family and community does, but this is something that comes from the inside out. And the one example I gave yesterday of something remarkable was there was a gentleman that was dying of a neurologic degenerative disease, and he was already in a sleeping stage. And so we gave him the gold, and within, minutes, he woke up, but was confused. And the family settled him down, and so he went back to just calmly sleeping. And the daughter came in later, had no idea that anything had happened, and she walked in, and the first thing she said was, "What happened here? Dad is in this room. Dad is in this room," and he was in that room for the rest of the day. And so she was sensitive enough to pick up there was something of his soul spirit that really was strengthened. So that's enough evidence for me. And there's been a few other things too. So I think it's just the right thing to do. And people are fairly open to it. I have to be kind of cautious because the last thing you want to do is say, oh, let's do this homeopathy, and they think you're some strange person doing weird stuff. So anyway, but I'm surprised, even the Baptist belt, they're very open to anything that supports soul and spirit. So as far as what's available for people in the home environment or even in a hospice that will let you do whatever you want, there's topical, oral, and injectable. It's gold by itself, or it's compounded with lavender and rose, particularly for topical applications. And sometimes it's in the, with frankincense and myrrh, the Olabama myrrh, oral or injectable forms. And so people really like, oh, it's gold, frankincense, and myrrh. And the words I use are, we can provide the essence of gold, frankincense, and myrrh. And a lot of people just go, oh yeah, I love that. And you know, they may pull the frankincense out of their purse, the essential oil that they've been sneaking in and using anyway. So it's a wonderful thing. And as far as discerning whether to use a low potency or a higher potency of these gold formulations, generally the lower potencies work more towards metabolism. So if you've got somebody that's in the early phase of dying, there's more of the metabolic chaos going on, or somebody who's strongly metabolic, it's nice to start with a lower potency. And the higher potencies, it's advised that you can use it at the very end because it has more of a, rather than a stabilizing like the lower potency, it has more of a dissolving quality, and that's really attractive when you're about to go to the next stage, or if you're already kind of too much nerve sense person, you're kind of pale and you think too much and you're kind of skinny, you know, that's kind of when the higher potencies are useful. And as far as the specific formulations, the topical are absolutely the easiest. And so there's a reference for Aurum, lavender, rose, heart ointment cloths that can be applied. But there are creams and ointments. And all the pharmacies have good preparations. And the only distinction is that Uriel's includes the peat and the frankincense and myrrh and some equisetum that helps kind of with the astral body, and a little bit of chestnut and hypericum. So it's got, you know, Mark tends to roll a lot of stuff in it once, but all of them are great. And then the Olabama myrrh compounds, I think I did this again, but I'm going to go back because they're not going to see these slides, right? So if I just say what's on the other slide, it'll work, right?
Yeah, everybody's going to get the full slideshow. So it's
yeah, so I can just go back to the slide I just missed.
Yeah, that's fine.
So Aurum comes as single ingredients, and they come as single ingredients in a low or high potency. And so you have that choice, and it comes as globules, liquid, or ampules. And so the discussion around oral is easier to use because you don't have to learn how to inject something, but it is something you have to give 3 to 4 times a day. And when people are stressed, that may be just too much. Depends on what stresses you more. And then at the very end of life, if somebody has really terminal secretions where there's a lot of secretions and inflammation that don't respond to our usual repositioning and some simple drying up medicines, then adding oral liquid is really just, it makes it worse. So it's really nice to have it. I've never used globules, so that may be easier. But anyway, so oral has that advantage. Whereas injections, it's once a day, and it's not that hard. I mean, lots of people learn how to inject mistletoe injections. A lot of people have nurses or doctors in their family that can do it easily. It's subcutaneous, it's not IV, so it's not that hard, and it's just once a day. So it's really kind of nice to have that at end of life when people can't swallow. So that's the difference in so in the early phases, I usually work with something oral. In the later phase, I personally use the injections. So if we look at the next grouping, it's the gold that has the Olabama myrrh compounded, the frankincense and myrrh. So once again, you have the lower potency orally, which is Uriel's Aurum, Olabama myrrh liquid ampules. And it also is, I didn't write this in, I'll have to change that. They have pellets and tablets. So this is also known as the threefold balance pellets, which is for the stress of civilization. So that's what that actually is. But this is kind of the more formal name, and because it comes in other formulations. So it's the low potency Aurum, so it's great for early on or with a metabolic constitution. The higher potency is from Weleda. It has Aurum D30, so it's really nice for the end of life if somebody can still just take a small amount of liquids, they don't have a lot of secretions. Or if they're a neurasthenic constitution. So those are the options. And we'll recap this so it's a little clearer at the end. Copper is just warming. So the dyeing process, typically, not always, the people get really cold in the extremities as they're excarnating, or if their circulation is getting worse, then they'll have spasming of their calves, or if they have like a restless leg or leg cramps, it's really nice to be applying the ointment to the feet or the feet and the calves to just warm up that part. And like I say, I think I project how uncomfortable it must be when I see somebody with stone cold legs. It just doesn't look comfortable. And I know Stephen Johnson has told me that sometimes when there's a long vigil and people, they're in that active dying process, but they're just not leaving, something's hard. And so if they've got really cold legs, the way I imagine it is if you warm them up, it's kind of like getting a running start. It's kind of like you pull in the astral body and then it can go out more easily. So it seems to help that. So it's kind of a win-win sort of circumstance. And so these are the 3 preparations that are available from our 3 pharmacies. And just to point out that there's a difference between Uriel and Weleda. Weleda is under FDA certification, so they require prescriptions for a lot of these remedies, whereas True Botanica and Uriel are under homeopathic. And so they don't necessarily need a prescription except for things like mistletoe. So that's why it's that way, but it's really easy to have somebody prescribe it. So it shouldn't be an obstacle, and they're wonderful products. So I'm going to come at it now from another direction. We're going to talk about when you see fear and anxiety. And this is where I'm going to get my notes out. It's frequent, sorry. Let me just do this so it's going to be much more fluent if I can get these notes up.
Now, take your time. I mean, I think there's been so much amazing practical offerings so far that I certainly didn't know about any of these, and I didn't know about the Aurum with death and dying. And so it's been really good to see all this, and copper too. I mean, it's really helpful. So thank you for putting it out so clearly for us.
And I will say that the reason I really love copper is when I've been working a hospice over the weekend, I'm walking back and forth, back and forth, back and forth down the hallway. So when I go to bed at night after that, all of a sudden in the middle, it's like, and my calves just kind of go, and if I just put the copper on it, it just relaxes immediately. So I can speak to its efficacy. It's wonderful. I love the stuff, and it's got a lovely smell, and it's kind of a fluorescent rose color. So it's lovely. So the fear and anxiety is really a prominent symptom at end of life, and there's lots of good reasons. I mean, people are afraid of having pain. They're afraid of not being able to breathe. They're afraid of their family going to be upset without them, or are they going to miss their family? Oh, geez, I didn't get to do this. I mean, there's all these things. There's spiritual experiences they may not be able to make sense of. So anything you can do to normalize what they're experiencing and elicit if they're having any peri-death awarenesses, because that's really common to see loved ones, or people will report that they're seeing Aunt Becky on the other side. I mean, this is very common. So to make it normal is really helpful. And then there's just the existential angst of what is my life about, what's going on. I mean, and so anything you can do to be a listening presence, and really human presence is one of the most important things you can do. And certainly human warmth as applied through a nursing application is like wonderful. So I can't say how important those nursing applications are. And it just helps kind of soothe and sort of bring the fourfold imbalance back into a better balance. But the body's dying, so it's not an easy thing. So anything we can do to normalize and say you're not alone is really helpful. So specifically with anxiety that has tension or mental strain, so when the brain is kind of just causing worry, if you see that their hands are really cool, the copper is obviously a good thing to use. And this is the next thing is the Orem lavender heart ointment cloth is good for everything. And so in the particular situation where there's sudden anxiety at night, for some reason, putting it on the hands is helpful. There's a caution that there's something very intense about putting the gold on the hand. I mean, it's kind of an intense thing. So it's meant to be done with great, it's not like you go in there and just kind of rub it on and do it 3 times a day or anything like that. It's meant to be a very special thing. And so I think the nurses would want us to be respectful of what they spend a lot of time trying to learn. But the heart ointment cloth is a little bit different, I'd say. And then bryophyllum is a substance. It's the mother of millions or thousands or something, but it's got strong etheric forces. I mean, it creates babies, right along the side of its leaf. And so anxiety will happen at end of life because the physical body is declining. The etheric forces are kind of loosening from the physical body, and they're waning, and the astral body, the emotions are kind of flying out wildly because they're not well anchored. So bryophyllum has the ability to kind of just re-anchor things back in the physical body. And so the nice thing that can be used is a bryophyllum trit, which is just a little powder. I don't know if you've taken any of the anthroposophic remedies before, but it's just a tiny bit on the tip, smaller than a knife tip probably for the dying person. And you just put it in their mouth and the buccal mucosa so they don't have to swallow anything. And then the Orem lavender rose heart ointment cloth. Once again, just trying to support the spirit from within, and that's the center. So it's really helpful. And I just put this in, usually at the very end of life, we're not really worried about depression because they're usually pretty sleepy, but just so you know that the gold earlier, the heart ointment cloth is really good because it does bring a center. And it can lift some depression. And there are some prescribed remedies that have to be prescribed by the anthroposophic doctor that really the cancer doctors say is better than any antidepressant we have typically. So it's a wonderful thing. So just notice, we're always listing Orem lavender rose heart ointment cloth. So the losing center, like we've talked about, gold is the metal for the heart, which is your center. So any of the Orem formulations. So if I can just get them to put a cloth, it's fine. I feel good that I've done something, but if they want to go the full route with some of the other ones, that's even better. The copper, once again, if you have cold clenched hands with this. And then the fear with shortness of breath. The shortness of breath itself is a little challenging to treat. And I've tried some of the anthroposophic remedies, and it's really hard for me to see an immediate benefit, but they typically give 10 times the dose IV, and that's not a doable thing in the United States easily. So I think the thing we can do is deal with what I call the yikes part of shortness of breath. It's the existential, oh my God, I'm going to die. Well, they are dying, but they are anxious about it. So any of these things that we talked about, the Orem lavender rose heart cloth, the copper ointment, lavender oil compress or applications to the calves or the chest even, these are things that will at least alleviate some of that. And then pain, there's always an anxiety component to that. So those things still help in that realm. And the Orem remedies, it's like, we know different people, like some people are devastated by a hangnail, and other people, they have, a necrotic leg, and they're not in this, there's a spectrum. So something about who they are and how they react to stress, how they've had a meditative path, and how much, there's a lot of things that go on, but the Orem will support the soul and spirit from within. So it's good for supporting pain. And because they're going to be on a lot of pain medications, typically for the more difficult pains, it helps mitigate it. So Orem remedies are great. And the Solam oil, like I said, has shown in research to help chronic pain, and it's also good for nerve pain. And then another wonderful product that both Uriel and Melita make it's a lavender quartz and aconite preparation that's topically used, and it smells good, and it takes a layer of the severity of the nerve pain. It doesn't take it away, but it really helps, and it's just no side effects. So it's a good thing to use. So This is the list of our anthroposophic pharmacies and the one who provide body care products. Hauschka is well known. True Botanica does wonderful things, and we know Uriel and Melita too. And like I say, the difference between Melita needing scripts, as I explained before. And then this is a wonderful resource for all these applications I've told you about. The Vademecum is a website that has descriptions of substances used, and then the indications for the use and how to use them, where and what kind of application. And so there's a nice, I would advise you, because you're going to use Orm Lavender Rose Heart Ointment Cloth for everything, go download the instructions for that one, because it's really quite simple. And I've taught the people in my hospice to all do it, and it's very easy, and it's a lovely thing to do. With things like the Rose Oil Rhythmical Einreiben, which is a specialized training that's distinct from rhythmical massage training, both good, but have a slightly different training. So they describe, you know, how you would do the rhythmical Einreiben, but they say, but if you don't have somebody that knows how to do it, it is worth still having somebody who loves the person just do a gentle application on the back. And so they let you off the hook as far as you needing an expert. The love of a family member really goes a long way. And likewise with the lavender, you know, it's very helpful to do it on the foot, kind of to draw kind of that jangled astral emotional body and kind of just draw it back into sort of a metabolic pull, so it's not causing so much anxiety. It says, ideally rhythmical Einreiben, but it's okay to apply it as a loved one to the foot. And so we go by that. And the Solum likewise on the back, same instructions. So if we inspire somebody to take the training, that's great. And we're sponsoring a training here for some of our hospice aides and nurses here in Flat Rock at my hospice. And so I'm hoping to kind of inspire that this be done more in hospice organizations. So this is the references that I think are helpful. The internal medicine text is, you know, most people aren't going to go out and buy this text, and it's not available online, but it really is a really good internal medicine text that was just translated 3 years ago. So this is a big deal for us. But the palliative care group guidelines are posted here at this website. It's free access, and the important thing for people to know is that in addition to the medical and nursing applications, they go through what you can use for eurythmy, for speech therapy, for, you know, full rhythmical massage and all that kind of stuff. So if you're in an anthroposophic community that has those practitioners, you will see the kind of resources that can be used. Little Po had a nice issue in palliative care in the spring. And then I just listed the Life Beyond Death book, Life Between Death and Rebirth by Steiner, which I love. These are credits for the lovely images that I used for the slides. And then this is kind of the bottom line synthesis of what would I do if I or somebody else may, what should I get for my loved one? So it's a given that you get Orm Lavender ointment or cream. I think a low potency oral Orm preparation and the threefold balance pellets, tablets, everybody needs them because there's a stress of civilization. So it's a win-win there. And then a high potency gold for maybe the end of life, or if somebody really is kind of a nerve sense pull kind of person, get some copper ointment or cream, get some lavender and rose. You'll use it for a lot of things. And the bryophyllum, if you really think your loved one will either have a lot of anxiety or you feel like they will refuse to take medicines that might be sedating, so you want to have something that can kind of help them through that if they refuse. And I've listed Uriel's Hospice Comfort Kit. It's very sweet. It's a lovely thing if you want to offer it, buy it for a friend who's going through it. What I find is that the products are wonderful, but the Orm Lavender Rose, the threefold pellets, the rose oil, they're small sample sizes, so if you use it as much as I'm saying here, you probably need a bigger container. And family can always use them. They're not going to waste, you know, and I think everybody should have some for themselves and some for their loved ones, because it's very stressful and there's variability in the constitution of people who are accompanying. And so we want everybody as calm as possible. And that's why I like the Orem Lavender Rose, because when you put it on, the whole room gets filled with lavender rose and the people calm down. So it's kind of a 2-for-1 sort of application when you do it as a ritual.
Yeah.
So,
I was going to say, I remember you saying yesterday that everybody should be taking that, like the family and I'm really curious about that. I know we're coming to the end here, so go ahead and say what you're going to say. But
I was going to say, you know, we have this little, somebody bought a little heart-shaped wicker basket where we have these supplies. And I noticed that the hospice staff would just kind of go in the back, put them on and put it on their chest. They just knew that it was something that helped them be centered for their work. And I think that I mean, I put the Orem Lavender Rose, I've been doing that for probably 15 years now. And it's just, you know, I can't tell what it does for me because I haven't tried not using it. And I think everybody around me is happier if I use it. And it's just, for some people who are very sensitive, I think they really understand the value. And it's sometimes, it's like mistletoe. They just say, I feel more like myself. And that's a big deal in the face of chaos. So I just think it's a wonderful thing to have people take. So they should put it in the water somehow. So if I were in charge of the world, it would be in the drinking water.
That's so great. So if we know someone whose parent is dying or they're going through a situation like that, where they're involved in death care of some kind, the Orem Lavender Rose would be a nice thing to give to them to take care of themselves. Mm-hmm.
Yeah.
Okay.
Yeah. And, you know, I think any lavender oil or bath oil, I mean, people who like baths to sort of relax, the more lavender oil for the relax. I mean, there's just products, it's a win-win, and there's such high quality products, what's made by the anthroposophic companies, that it's not going to be perfumey at all. I mean, it's for people, I mean, but you do always have to ask, do you have a sensitivity to lavender rose? And it's a rare person that does. But if they do, there are other things we can do for them, you know, so you do ask always.
Great. We did it. Thank you.
Yes, we did it. Well, this was fun. Let's do it tomorrow again. Might be even better. It'll be different. Yeah.
I think everyone would like that, actually.
Yeah.
Thank you so much for giving, again, such a practical, down-to-earth, and super spiritual advice here to all of us, and all these, this understanding of the different bodies and what happens during death and how you can help with the fear and the anxiety, and then some of the physical symptoms. Really fantastic. I'm just in awe of the doctors and what you have done in your training and how you're helping people. And it's so nice that you, in particular, I hear you really bringing this into mainstream care and offering it to people, especially the nursing applications and things like that. That's just fantastic. Thank you so much for doing the work you're doing.
Thank you. It's my pleasure. I love my work.
Oh, awesome. Okay. Well, thank you. And I'll talk to you again soon.
Okay. Thank you.
Thank you. Thanks, everybody, for tuning in. Bye-bye.